Hello everyone, welcome to my channel Dentistry Made Easy. So, as I yesterday said in my last video that I'm going to post pictures and videos of all my notes. So here is my first video, Gingival Recession from Periodontology. And if you haven't watched my video, then it's linked down in the description box, and the video is all about how you're going to score good and the highest marks in your exam and you can top your university exam. So starting off with first topic, gingival recession. So what does gingival recession mean? Gingival recession is nothing but it is the exposure of the root surface due to the apical shift in the marginal gingiva, which is given by Grant. Now this is way too difficult to understand, so I'm going to make it easier for you. So now going step by step. So the first point is it is the exposure of the root surface. Now as you see in this diagram, this is the teeth. Now the portion which you can see is the crown, and the portion which is covered by the gingiva is the root. And now what is gingiva? Gingiva is nothing but the gums in layman's term. So the portion which is covered by the gingiva is your roots. So I have drawn the picture over here. The crown portion which you can see over here, and the root, it is embedded and you can see them. uh, so so the first point is exposure of the root surface. So this is the normal picture of the healthy mouth. In this you can see there, like you cannot see the root surface, but in gingival recession what happens, you can see the root surface, you can see that root due to the apical shift. Now what does that mean? Now a crown and the root, it is divided into three portions. So crown is divided into three portions and the root is divided into three portions. So the first portion is coronal portion for the root, middle portion and the apical portion. Apical is because the lastmost point of the root is known as apex, so it is known as apical. And as it says, due to the apical shift, so there is apical shift in the gingival margin. So gingival margin is this, the margins of the gingiva. So now gingiva is again divided into several parts. So first is interdental gingiva. Now what does interdental gingiva means? Inter is something between and dental is nothing but teeth. So something between two teeth is interdental gingiva. So gingiva between two teeth is interdental gingiva, this portion. Then this is the gingival margin. Margin, as you know, is border. So this is gingival margin. Then this is free gingiva, over here attached gingiva, and as you can see there's this color demarcation. This is the mucogingival junction. So this is the junction between the mucosa, the alveolar mucosa over here, the darker portion as you can see, and the lighter portion, that is the gingiva. So mucogingival junction. Muco is the alveolar mucosa and gingival is the gingiva. So now there are several terminologies which are associated with this gingival recession. So when the level of gingival margin is below cemento-enamel junction, it is called as recession. Now what is cemento-enamel junction? So enamel, the teeth, it is covered by enamel, and what you all can see is enamel. And the root, they are covered by cementum. So the junction between root and the crown portion is known as cemento-enamel junction. So over here the cemento-enamel junction is not seen because this is a normal patient's picture. So this is, as you can see over here, this is the cemento-enamel junction, the crown portion and the root portion. Cemento-enamel junction, I have shaded it over here with red to demarcate it with the gingiva. So a cemento-enamel junction is covered with the gingiva. Then and it is called recession when you can see this gingiva, when you can see this cemento enamel junction, as your gingiva, it gets receded down. So gingiva may be considered hidden or visible based on the actual and apparent position of the gingiva. So now what does that mean? Now in this picture I have shown the normal gingiva. So this is the tooth surface and this is the gingiva. As you all can see, this is the alveolar bone. So in normal structure what happens, your gingiva is about the cemento-enamel junction. So you can consider this as a cemento-enamel junction. So it is about, it is covering your cemento-enamel junction. Cemento-enamel junction is over here and your gingiva portion is over here. So it's covering the cemento-enamel junction. Then moving on with the point actual position and apparent position. So now what does actual and apparent position means? So actual position is the level of the coronal end of the epithelial attachment on the tooth. So actual is this portion. Actual is when this is the coronal portion, like your gingiva is attached to the ground, so that is the coronal position. And basically this is nothing but the pocket formation, like when your gingival sulcus get deepens down. So what happens is your coronal attachment, the attachment of the epithelium, it gets lowered rather than attaching it over here. As I've drawn in the previous picture, the coronal attachment was over here. Then but what happens in recession and in periodontitis, it gets receded down. So this is the actual position, which is usually hidden. Like you can see them because the gingiva is covering this portion, and you can't see them until and unless you are using your probes. Then visible is nothing but when your gingival, so apparent position is the level of rest of gingival margin. So as I said, the gingival margin, so the gingival margin, it gets receded down, and you can easily see that your gingiva has receded down, and you can see your CEJ. So this is not the apparent position. Severity of recession is determined by the actual position. So how severe your recession is determined only by the actual position and not by the apparent position. Actual position, as I said, it is the level of epithelium attachment on the tooth, and like the coronal attachment. In the normal, as I said, in normal it is attached over here, but in recession it has gone down. Then the part of the root which is exposed to the oral cavity is called visible recession. The part covered by the gingival wall is called hidden recession. But recession is the sum of hidden and visible. Now moving on towards the etiology. Etiology is nothing but how gingival recession is caused. There are multiple factors why gingival recession is caused. So there are anatomic factors, physiologic factors, pathologic factors, and iatrogenic factors. So what is anatomic factor? Anatomic factors are nothing but your tooth position, like depending upon how your tooth is. So it can be malocclusion. Malocclusion is when your teeth are not in proper position. They are not in proper occlusion like they should be. And because of that, what happens? You're unable to clean your teeth properly. And because of that, finally, what happens? There is plaque accumulation. And this plaque finally leads to gingivitis and periodontitis. Then thin bony plates, high frenum attachment, fenestration and dehiscence. So, so fenestration is nothing but the isolated area in the root. Uh, it is denuded of bone and the root surface is covered only by periosteum. And the overlying gingiva is called as fenestration. Over here, this is fenestration. Over here, you can see the marginal gingiva is intact, but what happens? The bone, it is denuded over here. So this can be the cause for gingival recession. And over here, as you can see, that this is dehiscence. Dehiscence is when you can completely see your root and the gingival margin is not attached. So this is dehiscence. Then physiologic factors can be genetics, aging, orthodontic movement of the teeth. So orthodontic movement of teeth is nothing but the orthodontic movement of teeth is only possible due to PDL. So PDL is a part of your periodontium. So pathologic factor is toothbrush injury. Toothbrush injury can be abrasion, impaction of foreign body, plaque-induced inflammatory disease, and surgical treatment. So so this is the main cause, like basic cause which you can say like main causative agent is plaque for any periodontal problems, because if there is no plaque in the patient is not going to come with any sort of gingivitis problem or periodontitis problem. And if the gingivitis problem is not solved, then it gets converted to periodontitis. And all this recession, pockets, then bone loss, everything are the signs of periodontitis. And I'm going to cover all these topics in my further videos. Then iatrogenic factors are the factors which are caused because of us, because of dentist. So first is improper restoration. So if there is improper restoration, you're unable to the patient is finally again unable to clean their teeth properly because you haven't done the restoration properly. Like there are some overhanging. So because of those overhangings, the toothbrush cannot come properly. Like you can't brush your teeth properly because of those improper restorations. Then clasp, deleterious habits like holding pins, nails, and like habits like some people have the habit of scrubbing on the gingiva. So because of that, the gingiva gets receded down. So these are the etiologic factors. Then moving moving on towards etiopathogenesis. As I said, the main causative agent for periodontitis, for that matter, is plaque. So what does inflammation means? Inflammation is nothing but the defense mechanism or the protective response which is elicited by an injury. So plaque. So over here I have drawn, this is gingiva, this is the tooth, and the yellow color is the plaque. So plaque, they contains various bacterias, and I'm going to cover plaque too in my further videos. So plaque, it contains bacteria, and our body has that response. Like if our if there's any antigen in our body, then our body is going to release some antibodies to fight against it. So what happens over here is the neutrophils are released, and neutrophils are nothing but they are the first line of defense. So over here neutrophils are released. So now what is now the process of engulfing is known as phagocytosis. The neutrophils, they engulf the bacteria to kill them. So neutrophils, they releases harmful chemicals to kill these bacteria, but these chemicals are so harmful. Like all this process is going on near this connective tissue, so these chemicals are so harmful that they destruct this connective tissue of the gingiva. So because of this, there is destruction of connective tissue of free gingiva. So as this connective tissue is destructed, as your connective tissue, it consists of vascular supply, as it contains cells, blood vessels, nerves. So because as your connective tissue is destructed, there is reduction in the blood supply, and as the lesion progresses, if there is no treatment done on proper time, so the lesion, it gets progressed, and because of this, the connective tissue, it is completely disappeared. And because of this, there is fusion of oral epithelium with junctional or circular epithelium. So oral epithelium is this, the outer portion, the middle portion is the junctional epithelium, and this one is the circular epithelium. So oh sorry, this is the junctional epithelium, this is circular epithelium, and this is the oral epithelium. So what happens is this two epithelium, they get fused to each other. So because of this, there is apical shift. As I said, in the definition, apical shift is towards the apex, towards the root. So there is apical shift of this marginal gingiva. It shifts apically, and because of that apical shift, there is exposure of root. So the roots get exposed, and there is formation of recession. Then moving towards the classification, there are many classifications which are given by many authors. So the most widely accepted classification is given by P.D. Miller. So this classification, it has four classes: class 1, class 2, class 3, class 4. So these diagrams I have drawn on a plain sheet of paper. So these diagrams are very easy to draw, and you can draw this diagram on like in your exams also. And I'm going to post pictures of all these diagrams on my Instagram page, and which I'm going to link down below in the description. As I said in my video, that I'm going to post all the pictures of these notes on Instagram page, so that you can save these pictures and you can have a better view of them. Going on, moving on towards class 1. So what does class 1 means? Class 1 is, it includes the marginal tissue recession that does not extend to the mucogingival junction. So as I said, mucogingival junction is it is the junction between the mucosa, alveolar mucosa. This darker portion over here is alveolar mucosa, the red portion, and this, the pink portion, is your gingiva. So this demarcation is the mucogingival junction. So class 1 is when the marginal tissue recession, it does not extend this junction, and there is no loss of bone or soft tissue interdental area. So interdentally there is no loss. So this type of recession, it can be of two types: wide and narrow. Wide is more surface area, like you can see over here, and narrow is, it is narrower. Then class 2 is when the marginal tissue recession is, it extends to or beyond the mucogingival junction. So over here, as you can see, it is extended beyond the mucogingival junction, and again in this there is no bone loss or soft tissue loss in the interdental area. The interdental area is slightly like in the normal patient it is because gingiva it holds your tooth in the socket, and if there is loss of the gingiva, then what happens is your teeth get loosened up, so there is mobility because of this. So class 2 is when marginal it is beyond mucogingival junction. Class 3 it extends to or beyond mucogingival junction, and there is bone or soft tissue loss. Over here, as you can see, there is bone or soft tissue loss, and because of this, there can be malpositioning of the tooth. Class 4 is again when it extends beyond mucogingival junction and there is severe bone loss interdentally. Like that, it is like the most severe case of gingivitis and periodontitis. Sorry, periodontitis. And there is severe mobility because all the interdental gingival area is receded down. Then there is again another classification which is given by Sullivan and Alkine. So in this again there are four classes. So class 1 is shallow narrow. Shallow narrow is above the buccal junction and narrow. Then class 2 is shallow wide. Shallow is above the mucogingival junction and it is wider. Then class 3 is deep narrow and class 4 is deep wide. Deep is beyond mucogingival junction narrow, and deep wide is beyond mucogingival junction and it is wider. But mostly we are using PD millers in our clinical practice. So I'm going to show some pictures over here. This is class 1. As you can see, this darker portion is the alveolar mucosa and this lighter portion is the gingiva, and this is the gingival margin. As you can see, the normal like adjacent they are normal, like your gingival margin is present over here, and over here it has receded down. So this is the diagram which I have drawn. Then class 3, as you can see, there is interdental soft tissue loss. Over here interdentally there is spacing which is present, and class 4 is the most severe one. As you can see, a hollow space, actual hollow space you can see, and radiologically you can see is there is radiolucency between teeth and they are too mobile, and they have the worst prognosis as they are class 4. Then the clinical significance. Clinical significance is first how you're going to see clinically the recession. You're going to use your periodontal probes. Now the periodontal probes they have several markings over it. So now you're going to place this periodontal probe on the tooth surface. Then you're going to feel some roughened portion, and that is the CJ, a roughened portion, because it is a junction. So junction is obviously more roughened than normal enamel, which is more smoother than you can see. So over here this is CJ, more roughened portion, and it is so over here, yeah. So over here it is CJ, and then you're going to place your probe on CJ till the gingival margin and you're going to calculate how much it is, like in mm's. So, so what are the clinical significance? So first is exposed root surface are susceptible queries. Obviously, now your root surface is exposed. Now there are more possibilities of root caries. Then second is exposed root surface on the anterior teeth is often aesthetically unacceptable. Obviously, if you have recession on your front teeth, anterior teeth, then it is going to look unesthetic. The wearing off of the cementum exposed by recession leaves underlying dentinal surface that is extremely sensitive. Now what happens is now your root surface, as you can see the root surface in recession. So when you are brushing your teeth, so this cementum it gets exposed off, and after cementum the next layer is your dentinal layer. So because of the wearing off of the cementum, you're going to expose your dentinal tubules, and because of that you're going to feel sensitivity. Then there is hyperemia of pulp. Hyperemia is more blood flow. Then interproximal recession, they create space in which plaque and food debris can accumulate, as you know, spacing. So because of like in class 3 and class 4 there is interproximal recession which creates spaces between this, and what happens, we are unable to clean this area properly, so the plaque and more food debris they get accumulated in this area, and again it leads to more severity of periodontitis. And the last clinical significant is a sibilant speech. Sibilant speech is nothing but hissing sound, like you can pronounce some letters properly. Now moving on towards the last part of this video, treatment. So in treatment, first what we are going to do, we are going to record the magnitude of recession, like how severe your recession is, whether it is class 1, class 2 or class 3 or class 4. So you're going to first record the severity of recession. Then second is eliminating your etiological factors. So now what etiological factor, because of what recession has, like what is the cause for recession. So first you're going to eliminate it. Then third is you're going to apply topical desensitizing agent. Now desensitizing agent is because if you have sensitivity, then you're going to apply desensitizing agent so patient don't feel that sensitivity. Then fourth is gingival veneers. As you know, the tooth veneers that are like, they are into trend right now. Like people are using veneers for aesthetics, so like that only there are gingival veneers. So like this, like in this picture you can see that there is recession, and these are the gingival veneers. They are made up of acrylic. Only the gingival portion is covered with acrylic, and you're going to place it over, like you're making complete dentures, so the upper portion without teeth is basically that only. And lastly is the surgical procedures. This is the option only when there is, when the recession is more severe. So now treatment based on gradings. So if it is class 1 and class 2, first you're going to tell the patient about oral hygiene instructions, like which brushing techniques the patient is going to use, then which all like mouthwashes you're going to prescribe him with chlorhexidine mouthwash, as the patient is coming with gingivitis and periodontitis, so you're going to prescribe him mouthwashes. Then if the patient is complaining of sensitivity, then you're going to give him some desensitizing agents. Then oral hygiene is like you're going to tell all those procedures: brush twice with soft toothbrush, then which brushing technique you're going to tell that patient has a test recession, so you're going to tell modified Stillman's technique. And second is patient's education and motivation, so you're going to educate and motivate that patient for this oral hygiene practices. Then third is scaling and polishing. So this is the basic treatment for any gingival problems that you're going to do: scaling and polishing. Then lastly is this surgical procedures, like root coverage procedures. Then for class 3 there are mucogingival surgeries, oral hygiene instructions same as class 1 and class 2. Like in all classes you're going to tell the same instruction, like class first 3 points are going to remain same for all the classes. Just the difference is over here in class 1 and class 2 you're just going to cover the roots with some procedures, and over here as you have seen your interdental gingiva is also receded. There is loss of interdental gingiva, so over here you are going to do mucogingival surgeries rather than doing root coverage. So and in class 4 you're going to keep patient on maintenance phase, like there are multiple recall periods for this class 4 patient, like you're going to recall that patient in certain like after certain time to see whether the surgeries with the treatment that you have done is responding in a better way or not. So all these surgical procedures I'm going to take in my further videos, like I'm going to explain all the surgical procedure well in my further videos, like what all mucogingival surgeries are, what all root coverage procedures are. I'm going to explain them well in further videos, like what all procedures are there. Then based upon distribution, treatment based upon distribution is, it is distribution is localized and generalized. If like if there is 30% of recession in the whole mouth, so it is localized, and generalized is when all the teeth in your mouth is having recession. So for localized, again this all are surgical procedures like guided tissue regeneration, deep double papillae and laterally displaced flaps, coronally displaced flaps, semilunar flap for localized. And for generalized there are soft tissue autograft, subepithelial connective tissue graft, coronally repositioning graft flaps. So all this procedure, again as I said, I'm going to take in further videos. I'm going to explain each and every flap, each and every surgery well in my further videos, like what all flaps, like how they are done, like what is the indication, contraindication, and everything in my further videos about all these flaps and with good clinical pictures. And over here even have taken one example of this subepithelial connective tissue graft. So I'm going to show you one clinical picture of this, like at least you will get idea of how they are done, like for this one. So this is an example of subepithelial connective tissue graft. So now what it is, this is the preoperative view of the patient. This patient is having recession. It is class 2 recession, as you can see. It is beyond mucogingival junction. So what we are doing is, now what is autograft? Autograft, so this is the grafting procedure. Autograft is nothing but you are taking a tissue portion from the same patient, like from some parts, like some other position, and you are grafting it, like you're suturing it to the other position but from the same individual. So that is autograft. So over here what we are doing is we are taking an incision at the level of CJ on the recessed tooth. Then we are making two vertical incisions. Then we are going to join this two vertical incision with this horizontal incisions, and finally we are going to deepithelize it, like we are going to remove this portion subepithelially. Not, we are not going to remove whole chunk of the gingiva. We're just going to remove a thin layer of it. And then what, this is the donor side. Donor side can be multiple sides. So for over here we are taking palate as a donor side. So what we have done over here, we have made a template, like we have measured this properly, and then with that we are making a template and we are measuring it over here, and it is a 2 to 3 graft, and we have taken this graft at the level of premolars. As you can see, these are premolars. So over here we are taking this graft, and then we are taking it and we are suturing it over here with these sutures. And so finally we are taking this portion, we are suturing it over here. So this is graft. And in flap, what it is, like you are making incisions, and what you're doing is you're repositioning it, so you're lifting this gingiva up. So that is flap. You're not like moving some portion of other tissue to this. So you're not moving anything, you're just moving this portion of your gingiva and you're suturing it above over here. So that is flap, and I'm going to explain it well in the further videos. So this is sutured, and then we are applying the periodontal pack over here, over it, so there is good healing. And this is post-operative view after 3 months, so you can see how severe this gingival recession was and now how it looks post-operatively. So I'm going to post and if you find this video helpful, then do like. And if you have any doubts in this lecture particularly, so do leave a comment, like what topic, like what difficulty you faced in this, so like what doubts you have in this topic. And I'm going to, and if you have any suggestions, like if what topics should I do before, like prior to what I have planned, so you can write them down in the comment section below. And do subscribe to my channel so that you can know like what all topics I'm going to take. I'm going to like post every day one topic so that you can study well. And now this notes which I have prepared is like complete notes. You don't have to like go back to your textbook and refer to various textbooks, because already have made this notes from 2 to 3 textbooks, and all those textbooks are standardized ones. So like if you have this note, you can write everything from this in your exams, and you are definitely going to score good marks for this topic and for my further topics also which I'm going to take. So this is it for gingival recession. Hope you find this video helpful and hope you like this video. uh, Thank you very much.